The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha and mabuhay. Good evening, magandang gabi po sa inyong lahat. Naimbaga sardam, maayong gabi sa inyong tanan. I'm yours truly, Dr. Mary Faye Axon Armstrong, founding president of the Asian American Pacific Islander Nurse Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. Here we are again on a Monday night, bringing you important information to keep yourself healthy. Well, today is National Native HIV/AIDS Awareness Day. It's a day to address the impact of HIV on American Indian, Alaska Native, and Native Hawaiian people, and we can help stop HIV together by reducing HIV stigma and promoting testing, prevention, and treatment. And tonight, it's going to be a very special night because we have three people who is going to educate us about HIV and AIDS. But I would like to introduce first and say a few background about Dr. Austin Nation. So Dr. Austin Nation earned his PhD in nursing from the University of California, San Francisco School of Nursing Community Health Systems in 2016. His dissertation focused on included substance use experiences of HIV positive young Black men who have sex with men, or MSM, and he was a former fellow with the National Institute of General Medical Sciences initiative to maximize student diversity. Dr. Nation graduated with a Master's of Science in nursing with an emphasis in leadership and education in California State University, Fullerton. He was awarded the CSU Sally Casanova Pre-Doctoral Scholar and recipient of the CSU Chancellor William Randall Hearst Award, International Understanding Award, and the Graduate Assistance in Areas of National Need, Clinical Teaching and Research Scholar Fellow, completing in summer research internships at both Yale University and Duke University as part of his pre-doctoral studies. He was also part of the UCLA-UCSF Minority Training Program in Cancer Control Research. And furthermore, I'm going to read more information about Dr. Nation because this is very important to establish his expertise on the topic. Dr. Nation is currently contributing to the body of research investigating substance use perceptions among HIV-positive young Black men who have sex with men. Black young adults between the ages of 13 and 25 are one of the largest populations of people being diagnosed with new infections of HIV and AIDS. The prevalence of HIV among young MSN is 3 to 4 times higher than white MSN, and young Black MSM are runaways and homeless, forcing them to survive on the streets by becoming sex workers, engaging in unprotected anal intercourse because either they or their partner is under the influence of drugs or alcohol. So without further ado, I would like to introduce Dr. Austin Nation. Would you like to say a few words, Dr.?
I would. Thank you for the opportunity to be here on this wonderful Monday night. It's a pleasure to be here, especially I get an opportunity to bring my student research assistants along with me. I like to share every opportunity that I do that they get opportunity to experience as well. Thank you for mentioning that work that I did. That was the initial spring off work that I had an opportunity to do. That is still a very passionate project that I speak on quite frequently, is the impact of HIV and AIDS in communities of color, particularly Black and Latino men. I've also done some work since then, or in addition to looking at the epidemic among minority transgender youth. And currently with my students, we're looking at LGBTQ healthcare and mental health care access among populations here in Orange County, California. So I've been really running a quite busy research agenda, which has been really, for me, an honor to continue to give back to my community in this way. So again, it's a great honor to be here with you tonight.
Yeah, thank you for agreeing to be our special guest tonight. So hard to get you, Dr. Nation.
Thank you.
So busy.
Yeah, thank you.
Yeah, so well, we have Kevin Sin, who is one of our students guest tonight. Would you like to say a few words, Kevin?
Hi, I'm Kevin Singh. I am one of Dr. Nation's research assistants here at Cal State Fullerton. I'm a third-year biochemistry major student here at Cal State Fullerton, and I joined Dr. Nation's research because I feel like the healthcare of LGBT individuals in Orange County is a very important and essential thing in today's world, and we gotta emphasize on it. And I would also like to thank you for having us on the show tonight.
Oh, you're welcome. It's my pleasure. What about we have Natalie Dobon also with us. Natalie, would you like to say a few words to our listeners out there?
Yes, hi. Hi, everyone. My name is Natalia Tabone, and I am a second-year nursing student here at Cal State Fullerton and also Dr. Nation's student research assistant. Throughout this time that we've been doing research together, I've learned more about disparities within the LGBTQ plus population, and it's been really interesting to find out more about the barriers affecting this community. So thank you so much for having us today.
Thank you. So, Dr. Nation, maybe we can start with statistics. Can you share with us, to our listeners out there, why this topic is very important?
Well, I think when I'm asked that question, the first thing that comes to mind is the health disparity of HIV and AIDS 35, 40 years later into this epidemic that is still what started as a primarily gay white communities of color. And so when we look at the numbers in communities of color, African American, Latino, Asian, Pacific Islander, all the minority populations, we see disproportionately high numbers of HIV/AIDS in these communities. And I believe still that the only way that we are going to get to zero new infections is that we need to put our prevention measures into those communities. First, by, I think, raising awareness that the epidemic is in those communities. And then two, making people aware of tools and resources that they can use to help mitigate this virus in our communities of color. So I still think we've got some work to do if we're going to get to a place where we can say we have no new HIV infections here in the United States. So we got some work to do still.
Yeah, and I think that the information that you, Kevin, and Natalia is going to provide to us and our listeners out there can certainly be applied in all of the different cultures. And I know you mentioned that HIV and AIDS used to be predominantly in the white population, but you know what? I think that we're taking away the stigma in the other cultures that now they're coming forward to identify themselves. And I think one of the reason, the barriers that we don't have information about the other cultures, because it's a stigma. It's you don't want any of your family members or yourself to be known to have the disease, right? And it's a disease that needs to be addressed. And certainly the other cultures we need to increase the awareness from the other culture. Can you share with us, I guess, with your students, maybe they can share a little bit about their role in the research studies that you're doing right now? Anyone, Natalia or Kevin?
Would you like to go first, Natalia?
Sure.
Go ahead.
Yeah, sure. I'll talk. So we were chosen as student research assistants to help Dr. Nation conduct focus groups. Focus groups are groups of 6 to 8 individuals, and it's kind of like a conversation interview style format in which we ask a set of questions and kind of go from there, probing based on what the participants are willing to share with us. A lot of the issues that some of the participants in our focus groups have brought up were their issues with substance abuse, dealing with depression, feelings of isolation, their HIV status. Luckily, a lot of them have used PrEP, so that's always a good thing to hear.
Thank you, Natalia. Kevin?
Yeah, so it's basically what Natalia said. We do focus groups of 6 to 8 individuals. We ask them questions regarding HIV, substance use, and anything related to that matter. And we also ask, what can we do that would definitely improve the healthcare access? We ask for, at the very end of our focus groups around there, we always ask them, hey, what do you feel like would be an amazing solution that we could introduce to the world of healthcare for mental health and physical, to where we can not only improve the healthcare access for LGBT individuals in Orange County, but we can redesign it to where it can become a whole new system that can just change the game entirely. So that's basically what we do in these focus groups. We ask them about experiences, uh, what can be improved, what's being done well, and overall, what can we change about it? So that's what we focus on.
So I just want to jump into, so what we're doing is we're doing community-based participatory research in conjunction with Radiant Health Centers and Shanti, Orange County. I always want to acknowledge and am grateful for the work that my community partners have done. We've been able to sort of, COVID derailed a lot of this when we first started it back in 2020. So I've had to come around to it again with the partners, and they've been pretty amazing. Also, Kevin and I had an opportunity to present this topic at a conference of the Association of California Nurse Leaders at their 2023 annual conference. Kevin, do you want to share a little bit about that as well, that experience for you as well?
I would definitely love to share that experience. That experience was an amazing time where it was down in Palm Springs. We went to the ACNL conference where we talked about our research to around, I would say around 100 or 70 individuals, right, Professor Nation, around there. So we shared our experience and like what we're researching because we want to spread the word about what we're researching. So we talked about, our statistics from the data, how like, LGBT populations are known to have disproportionate rates of HIV, substance use, adverse childhood experiences, depression, suicidality, completed suicides, and other mental health issues. So we kind of expanded on what we were studying on at the ACNL conference, and we spread it to all the individuals in that room we were talking about. And it was an amazing experience. I don't think I'll ever forget that day, to be honest, because it was a phenomenal experience.
Yeah, yes, it was. And it was actually for me one of the highlights of my career because we're talking to nurse leaders in the state of California and the surrounding area that's hearing about the disparity in the LGBTQ community. And these are leaders that are in positions to make change within the healthcare systems and various healthcare systems. So the fact that they were, one, just being honored to be a keynote at that organization, period, but the fact that these leaders were so engaged and receptive. We got bombarded afterwards, Kevin and I, in our post-conference debrief. I mean, people came around and they were asking questions and they were sharing their experiences and how could they improve the experiences of LGBT patients in their respective agencies and organizations. I mean, it was powerful. So I am surprised, as we were talking about stigma being such a force to be reckoned with around this topic, that people were much more receptive. This is the most receptive season of conversation I have ever had in my entire years of doing this kind of work. So something is changing out there. I think people are just more open. Maybe it's, the ease of seeing this stuff on television commercials nowadays. That people are much more aware. Natalia was talking about PrEP. That's our pre-exposure prophylaxis, which is certainly one of the prevention tools I always love to talk about when I am talking about this conversation, that people can take a couple of pills or they can get an injection to prevent from getting HIV. Like, these are new tools in the toolkit for our communities that are being impacted by this thing. And so we didn't have those a few years back. These are game changers in terms of helping people protect themselves and avoid getting this virus. So I'm super excited about it.
And you're so right. You had taken a big step in having the stakeholders and decision makers to hear about HIV and AIDS. And I think for our listeners out there, I wanted to do a two-step back, Dr. Nation, and just kind of do like a basic information to our household listeners out there in the community. I guess, maybe sharing briefly about the pathophysiology of HIV and how one is diagnosed with HIV, and even go further in how one is diagnosed with AIDS.
So my HIV 101 conversation is, we talk about the 4 body fluids that bring people in contact with HIV: breast milk, blood, semen, vaginal fluids. Those are the 4. So if you come in contact with them, this is kind of looking at it globally. I can say in the update in the 20 plus years I've been doing this, that we've done a lot of work around parent-to-child transmission in terms of countries that don't have access to formula, right, where HIV is a risk from parent to child. We know now that we can have an HIV-infected mother who can have a child, and we know how to treat that child so the child doesn't become infected. As far as blood, there's been a lot of controversy, debate around blood and blood transfusions, particularly blood transfusions for gay men, the ability for gay men to be able to donate blood into the system, and how blood is being screened for donation nowadays, right? The HIV testing is part of that screening for blood. A lot of the initial blood transmission stuff was coming through IV drug users. So people who were injecting drugs and sharing needles, that still remains a high risk if you're an IV drug user, that there is a risk associated with that. And we offer you ways to use safely, right? We're not stigmatizing or penalizing anybody for what they do, but whatever you do it safely. And, you know, and there are bleach kits and now many of the pharmacies, depending on where you are around the world, you can go into your local pharmacy. They'll offer you clean needle exchanges. That's progress from where we were years ago when that was so stigmatized. We want people to be able to inject safely if that's what you're doing. And then as far as blood, semen, vaginal fluids, those are often sexually transmitted diseases. Now, here in the United States, we talk about the lion's share of our infections. Well, globally, it's a heterosexual disease. So let me just put that out there. So when looking at it globally, HIV is still a heterosexual disease. It's heterosexual contact, male to female. Here in the United States, though, it shifts. It becomes male to male contact. And so we're looking at bodily fluids, often men who have sex with men being the biggest category of folks who are becoming infected with HIV in the United States. And so that's where a lot of our transmission efforts have happened. So you're looking at men of color, followed by women of color, particularly Black women. And this is always an interesting phenomenon to me, because I often, when I talk about this, say, well, how are women becoming infected, right? Well, it has to be with the men that they're playing with. So they talk about men on the down low, or men who are having sex with men and women, right? Men still may identify as heterosexual, but then, you know, if they're under the influence or partying or something, they may engage with sex with men, but they'll still identify as heterosexual. So we know a lot of that's going on in communities of color. So we're having outreach to those those communities as well. But the lion's share are gay, bisexual men, right? Men that we know are openly having sex with other men, and how can they engage in sexual activities that will allow them to play safely? And so that's where I think the lion's share of the outreach has happened through the years. What's interesting to me as I've watched these numbers through the years is that we're seeing a downturn in HIV among gay white men, where this whole epidemic started, but we're still seeing the uptick in the men, gay men in communities of color. So that again lets me know that there is still work to be done, and that we're not reaching the folks that need to hear the message by the traditional prevention measures that are out there today, that we're still not reaching what I would call our targeted audience. So thank you that we're able to put this word to the Asian Pacific Islander community as well, so that people can figure out if they perhaps put themselves at risk. And as I always suggest, if you're having sex and you're sexually active and you don't know your HIV status, you should at least take one test. If you're sexually active more frequently with multiple partners, and you should probably test every 3 months to know your HIV status and stay aware of what's going on, along with STI testing. I don't talk a lot about STI testing, but wherever STIs go, HIV goes, and vice versa. They travel in the same water. So if you're coming up with sexually transmitted infections or diseases, it would serve you to also ask for an HIV test if your provider's not offering that to you.
Yeah, and usually people who eventually get diagnosed with HIV were diagnosed with hepatitis C first, because some of the early symptoms were so similar, and so they would say, okay, let's treat you with hepatitis C. And you know that there is now information that you can 100% be fully treated out of hepatitis C now. in the past,
Absolutely.
like 10 years from now, or even 10 to 15 years from before, it's like, okay, you get the treatment, you get that, I forgot the medication that it's almost works like a chemotherapy where you need to be tested for or given a prophylaxis for depression because the medication itself can cause depression, right? And so what I'm saying is that the advanced technology and the medication now is allowing individuals to be free from hepatitis C, but we have yet to see with HIV. But I hear rumors that eventually there's going to be a treatment soon. So
Yeah.
yeah.
Yeah, no, you raise a great point, and that Hep C treatment is, they can cure you of Hep C now, and I think it's a 90-day treatment, once a day pill for 90 days, and they can get that virus out of your system. And then, of course, the other population that I didn't mention, and I was saying folks at risk, are pregnant women. So if you're a woman who got pregnant, or then you're having unprotected sex, you too then could be at risk for sexually transmitted disease today and HIV. So that would be another target audience. And the other ones that on the offshoot we mentioned, I also say people in prisons. We have in prisons. I've done some conversation in those settings as well, because as I like to say, things are going bump in the night. So
There would be another topic
that's
to probably bring you back in.
that's a whole nother conversation.
And I'm so happy that you mentioned global, because I like talking stories. I know we're kind of short of time, but I wanted to share this story to our listeners out there, just in case I haven't said this story before. When we took about 10 nursing students and 4 faculty to Uganda, Africa for a mission trip. So we were in the clinic where they sit with the Ugandan physicians while they're consulting the participants of our medical clinic, right? So here comes a young mother carrying her baby, and that she was newly diagnosed with HIV. And so the two nursing students from our university was sitting with a physician, and the physician said, continue breastfeeding your baby. And that's exactly what the eyes of these I don't want to call them kids, young nursing students, and their eyes got big like this. And so right after that, they came to me and the other faculty and said, like, I can't believe it. He said that to continue breastfeeding, and you know what's going to happen? She's going to give the HIV virus to the baby. And they're all panicking. And then so I asked the Ugandan physician to sit down with them and explain to them the difference between our population in the United States and our population in a third world country. And the Ugandan physician said that most likely this newborn is going to die from starvation before the newborn dies from HIV. So they don't even have, and said, oh, they can just give formula. And I said, it's easy for you to say. They don't even have enough, money to feed themselves 3 times a day. So that's why that the mother can continue breastfeeding the baby, because the baby at least have some nutrition and will not die from starvation and malnutrition. And so that's exactly how the Ugandan physician explained it, that the baby would first die from starvation, because the statistic shows that there are more newborn babies who die from starvation versus dying from the actual virus itself. So I'm glad that you mentioned about global, because what works in one country like the United States may not work in another country because of economical, status that they have. But I think we're digressing into our topic. So I'm going to let you lead this next portion of this conversation. I guess, what I'm saying is that whatever we're doing right now in our local communities may not work for other communities. And it's good for our listeners out there to hear it, because this is a program where other people from other countries are viewing. So I wanted to ask Dr. Nation, what do you hope to accomplish with the research study that you have right now?
I think kind of like Kevin and Natalia were saying, I mean, what we're doing, particularly when we ask one of our near final questions or last questions, is we ask a couple of things. Like we ask, How can we improve? People talk about costs being an issue, like how can we improve costs? Students, I don't know if you want to share anything to chime in on that. You want to share about what you've learned from folks around that question, because that is one of the questions we ask them. Any thoughts on that?
So, based on some of the focus groups that we've been conducting so far, a good amount of them said that they feel like costs should be reduced for insurance. A good majority of them said insurance-wise, there should be some more insurance provided for healthcare when accessing it, because it is a very big financial barrier for these LGBT individuals that we have been interviewing. They've been saying that insurance should be improved a little bit. Maybe a program could be introduced for these LGBT individuals that can help with these costs that they're facing. And that's mostly what we've been getting from these focus groups as of now, currently, so far.
Natalia, you have any thoughts?
Yeah. In one of the focus groups, some people have mentioned that because it can be difficult to find an LGBTQ plus like friendly or competent provider, they have to travel quite far to find facilities or areas where there are healthcare providers that will allow them to access care. So transportation is another big source of like cost or expenses in this population.
Right. And we want to understand what those are. We asked them those, we asked them what other barriers are there for them and how we might be able to improve them, about their experiences with the providers that they had. And they find out about providers who are even competent and knowledgeable in providing care to LGBT people. Oftentimes, well, in our study, in our initial survey study, surprisingly, most people were not hesitant to talk about and let their providers know that who they were, their sexual identity, sexual orientation and stuff. But people were still saying that the providers were either somewhat knowledgeable or somewhat sensitive. And so I really wanted to explore that topic, like what was that about? Very few people have said, yes, I got a great provider who understands me completely and understands HIV care, particularly when I think about our transgender community, our trans men and trans women who are trying to get hormone replacement therapy or sexual reassignment surgeries, to have providers who understand. I think some person said to me they had a provider that when they mentioned that the provider was just totally oblivious to how to navigate that terrain, even though there's resources out there. I mean, UCSF, where I went as a doctoral student, I mean, they have a whole center for transgender excellence. And there's a couple other places, that organizations that are out there that provide those resources. Fenway Institute comes to mind. I think even now here in Southern California, I think UCLA even has some resources available. And to your folks in Las Vegas, I'm sure as well, and around the globe, there are places and spaces nationally and internationally. If you search them, I would encourage you to search those places and spaces and providers before you go there, so that you're somewhat assured that you're going to get someone who understands your story and how to navigate your care based on who you are. So that's so critically important as we're learning from people directly from their stories. So that's been the most interesting piece for me, particularly as a qualitative researcher.
It sounds like we need to incorporate this topic in the training for nurses and also medical doctors, nurse practitioners. I mean, I guess the big question is on behalf of our listeners out there, do you think that if someone had been diagnosed with HIV, they should go with someone who is a hematologist or someone who is an expert in the HIV arena versus going to a primary care provider? I think our nurse practitioners, because it's going to be the future, is the primary physicians or primary providers a lot of them would be the nurse practitioners, right? So yeah. In your expertise, if, for example, someone comes to me, Mary Faye, I just got diagnosed with HIV, but I don't think my primary provider is an expert on it or seems like oblivious in my condition. So what should I do?
Well, okay, so now you're going to make me go on my soapbox, and so I think Kevin saw me do this at our ACNL conference. This is and it's my pet peeve, and I completely agree with what you just said. One, I think we do a lousy job in all the healthcare disciplines, nursing, medicine, dental, all of them, particularly nursing and medicine, right? Teaching people my fundamental sexual health. We talk about genital urinary. We make it very systems based. We don't talk about and teach our students how to do a sexual health assessment, to normalize sex, body, mind, sexual assessment, mental health, physical health, sexual health, like that. We should normalize that in my future, in my wish list. So you can talk about what people are doing sexually and sexual risk assessments. We still have so much taboo around talking about sex, even though we sexualize everything in society today, which completely blows my mind. So you're right. Our students have no training or education in how to do that. We don't talk about it. Our Nursing Student Association just asked to have HIV 101 presentation. So I brought in one of our pharmaceutical reps to come in, Gilead, to come in and do a presentation with them to give them that exposure. So we are really far behind the 8 ball with that. So therefore, if there's no HIV sexual health experience or conversations in your training, then you won't get any LGBT conversations. Don't expect your general provider to know a lot about HIV care, because where would they be taught it? Some programs are incorporating HIV, some HIV cultural competence into their programs. I don't think we do nearly a good job as we could do in terms of putting that curriculum intentionally into our program, so students can get a little bit of exposure while they're students, so they can go, for those that opt to go out into that and as a career, they feel like they have become sensitized. I was taking students to Radiant Health as a site, and students absolutely loved it. And many of them talked about how uncomfortable they were dealing with LGBT folks.
I was going to say,
which is what you see in society. People were afraid to deal with LGBT folks. So you say you're LGBT identified, and people are like, yikes, what do I do with you? So again, it's not a matter of me of like, you have a problem, which provider to go to. To me, it'd be like finding someone that is that you're able to talk to, explain your issues with, and their network tends to be connected with other like-minded practitioners. So my doctor has been known in our community for many, many years to be LGBT friendly. She's not from the community, but has been doing HIV care for a bazillion years. And so people know her, and her network, when she refers you, I'm like, one of my questions to her is this person LGBT friendly that you're referring me to? I want to know. So if not, then I can be prepared, and then hopefully she can put me in her network of folks. But you want to go where you can get the best care. So it doesn't hurt to look at a provider's credentials. Of course, I am a huge fan of our nurse practitioner colleagues. I think nurse practitioners actually can provide better care to communities, even though our medical colleagues don't agree with that and have still placed restrictions on them around the country, around the globe. I think nurse practitioners should be practicing in full autonomy of their education and background and experience to provide that primary care to folks, because I think we're more about delivering holistic health.
Mm-hmm.
That's how we're educated.
I agree with you.
Total person. We're just not biomedical. What's your disease diagnosis and how to fix that? But who are you as a person, that we can understand all of you that you're bringing to the party, because your disease process impacts more than just you. It impacts your family, it impacts other systems, it impacts people you live with, broadly attuned to than our medical colleagues.
That mind, body, and spirit that you're talking about, I'm a very strong advocate of holistic nursing care. Mind, body, and spirit. They're just not body. They also have emotions and spiritual needs. And I like it that you mentioned about providers who are LGBTQ friendly. You see, it's not that they're not knowledgeable about HIV or LGBTQ, it's the comfort. A lot of, I think if the faculty are comfortable in talking about what are the areas and what are the type of services, that how do we assess them? How can you assess them with probably the presence of HIV if you're not comfortable asking about their sexual orientation? or their sexual practices. And a lot of times when I cover that for my curriculum, when I teach, I forgot which one I teach, that has to do with sexuality and HIV. And you have to ask those questions. And we need to start having our students and faculty to be comfortable in asking those questions. Because if they're not comfortable in the clinical setting, how can you then guide your nursing students to be comfortable in asking those questions, right? So I'm really glad that you mentioned about that.
I'd be curious what the students have to say about that, because they are younger, and like, what do y'all see and hear, and what are you getting in your curriculum around these topics? I mean, Kevin's pre-med, Natalia's a nursing student. My other pet peeve before I say anything is my use of using gender neutral language for nursing, because that's now mandated, and we don't identify people as he and she. It's my other soapbox.
Yes.
But we call them a they. Even a nurse
Yes.
is not a she, it's a they. Our patients, until you ask them what gender they identify as, because we should be asking them so we don't misgender our LGBT people. Let them tell us what gender they are. I may look like this, but I prefer to be called she. Maybe I'm transitioning, I'm in an early stage, and my preferred name would be Sally, right? So you need to ask those questions. So I always like to do a little plug for that. But students, give us a little bit of what you're learning and what you're seeing at your levels.
Well, I just had clinicals yesterday, actually, a near 12-hour shift. What I'm seeing is that, especially a lot of the new grads, I've asked them a bit about what sort of ethics training they receive. Of course, every nurse has to understand HIPAA. Patient privacy is a huge thing, but because it is not just about data, numbers, telemetry, you want to know about your patient as a person. And each of my nurses, I'm on a neurotelemetry unit right now. Although the patient ratios can get a little bit crazy in a small community hospital, they really make sure that there are comfort measures for each patient, and it's very individualized, whether it be if they want to be referred to as a certain name, by certain pronouns, what they're comfortable sharing with in regards to their past social history or past medical history. It's very whole body, mind, and spirit based.
That's great.
So from my experience, recently, I think Thursday, I was working with Red Cross for blood donations, and I remember the nurses in the Blood Cross truck that were helping donate blood, they were very sensitive to their patients, because I feel like in a healthcare setting, you not only have to focus on what you're giving treatment to or how you're helping the patient, you also got to make sure they're feeling respected. So I remember when they were giving out blood donations, the patients who were in that setting, they were talking with them, they were sharing their life stories, they were making them feel safe in an environment where they're giving blood, because it's a scary experience when you give out blood. So what I realized was that it's very crucial for healthcare workers in the industry to know how to, be sensitive with their patients, makes them feel like they're in a safe environment, because it's a very scary experience sometimes. So I feel like it's a very big priority in the healthcare field, not only just to help your patient, but to make them feel safe and welcome in these new environments that they're, facing.
Wow, I love it that we're really diving right into emotional needs of our patients, right? Before we're just so focused on the body system and diagnosis, and now we're diving right into what it is that we can do for you, or how can we improve in providing the services for you. Wow. I think our healthcare system have great hope. Our future of healthcare system has great hope. So I know time flies when we're having fun. So we're going to wrap it up. And I'm really thankful, Kevin, Natalia, of course, Dr. Nation, for joining me tonight. I'm pretty sure our listeners out there are just like writing down notes, or maybe have to watch this episode multiple times to get all of the very important information to get them aware of the HIV and AIDS condition, and LGBTQ for that matter. So having said that, Dr. Nation, do you have any words of wisdom, brief words of wisdom to our listeners out there? This is global now.
Yeah, no, I'm just excited about all of the global and international awareness days that we're doing now, particularly, you mentioned this is Native American Awareness Day. Like, I'm so glad we're doing that, right? Because now it puts the focus for that day, for that minute, into that community to raise awareness about this disease. So I'm thrilled at the progress that we're making. And I dream of the days that we are not only zero new HIV infections, but that we actually can eradicate HIV and cure it and be done with it. That's my dream.
It's getting closer from what I heard, talking to the physicians and the researchers there. So Kevin, do you have any words of wisdom for our listeners out there?
It's not a sprint, it's a marathon. So you got to be consistent every day. Don't try to tackle it all at once. Just be consistent, and it can change a lot of things in life.
Natal.
My words of wisdom would be that your health is more important than fear or stigma. So remember that you're in control, and that knowing your health status can let you take charge of your health and keep yourself healthy by living well and getting care.
Wow, and there you have it. Thank you to our guest speakers tonight. This is a very special night to educate our listeners out there about HIV and AIDS and LGBTQ and mind, body, and spirit. So also thank you to PHLV Radio, Flora, and Johan Saison for giving us this platform to inform and educate our listeners out there. So our listeners, remember, every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with AAPINA of Nevada.